synthetic, given they are manufactured through conversion of mitragynine. Concentrated products are available for sale online, in vape stores, in smoke shops, gas stations, and undoubtedly other stores. It can be sold in a tablet or pill form, gummies or edibles, mixes or shots, and even vapes. In early summer 2025, Department of Medical Examiners started identifying cases with really high 7.0 and very low mitragynine, which was opposite the usual trend we see for kratom use. Levels of 7.0 in these cases were 50 to 200 times greater than the mitragynine levels, indicating a concentrated and adulterated product had been ingested and not the natural form of kratom. The first death occurred in April 2025 and was certified in September 2025 without any other competing causes of death. Around that time is when we also certified 5 other deaths related to 7.0. To date, there have been 7 confirmed and certified deaths directly attributed to 7-hydroxymitragynine. Of these 7 cases, demographics include at least 1 death from every supervisoral district, no persons experiencing homelessness, 6 white or Caucasians and 1 Hispanic and Latino, 6 male and 1 female, all of whom identified as cisgender. Ages range from 19 to 39. And 6 of the 7 decedents reported anxiety and/or depression. Of the 7 cases, postmortem toxicology revealed not only the 7-hydroxymitragynine, but also alcohol and/or prescription medications for anxiety or depression. They did not include any active illicit substances such as fentanyl or methamphetamine. Packaging in these cases can be very misleading, with, for example, 3 tablets in 1 package and the packaging noting 12 serving sizes, indicating each tablet should be cut into quarters. At this point, I'll turn it over to Dr. Brian Hurley from Department of Public Health, Substance Abuse Prevention and Control Bureau.
Thank you, Dr. Parks. Well, for those I haven't met yet, I'm Brian Hurley. I'm an addiction psychiatrist. I'm the medical director of the Bureau of Substance Abuse Prevention and Control, and I'm joined here by my environmental health colleagues online. The Department of Public Health heard from the medical examiner in September, just as was described, about the overdose fatalities attributed to 7-hydroxymitragynine. At the time, we put out a press release and a health alert to the community. The health alert included information around identifying and recognizing opioid overdose. Hydroxymitragynine is an opioid. It activates opioid receptors and can respond to naloxone, which is our standard guidance on what to do in an opioid. However, we put out an additional press release when we learned about the additional decedents identified from the medical. Then in November, we put out a notice to retailers to no longer sell hydroxymitragynine or kratom products. And our environmental health division that goes out to visit food retailers has begun what's called red tagging, that is identifying kratom and 7-OH products, which the FDA has listed are not a FDA-approved food additive. And again, FDA guidance is these are not suitable for consumption, to ask retailers to pull them off the shelves. Rationale behind that is we are seeing 7-hydroxymitragynine related overdoses. There isn't a universal labeling process that can be used to distinguish 7-OH products from kratom plant products. So when we see a kratom product, our determination is it poses a risk to the community, and so should be pulled off the shelves. So our environmental colleagues have, at this point, since we began our facility inspections, inspected, and my colleagues will correct me if I have any details wrong, something like 2,000 sites, and have identified retailers that are selling kratom products and are, again, renting those products and having them pulled from sale for the public. We also have launched a kratom webpage. It's on the SAPC website to provide information to the community about what kratom is. Kratom and 7-hydroxymitragynine sheet, again, to make sure people are aware of the overdose risks. And that's the current state of where we are with respect to what the health department has put forward, responsive to learning around 7-hydroxymitragynine or 7-OH overdose.
Thank you so much. And so, the purpose of this motion is not to criminalize, but it is to ensure consumer safety and health. So this motion has one directive, which is that the board of supervisors direct the Department of Public Health in collaboration with the Department of Medical Examiner in consultation with County Council to provide a written report back in 30 days with recommendations how the county should address and prevent deaths and harm related to Kratom and 7-OH, including but not limited to creating an ordinance, identifying funds and staffing needs, and outreaching to the public to help inform the recommendations to be made. So on that note, I will see if my colleagues have any questions for Drs. Park and Hurley on this issue.
I have a question. Victoria Gomez, second district. SAPC. I know it's going to be in the report back in terms of additional funding or staffing needs, but at this current time, what do you think on the SAPC end? Staff?
Forgive that I did not come prepared
Okay.
with a staffing analysis. There will almost, depending on the scope of the report and what we're recommending back, if there's additional enforcement actions, actually our environmental health team may need some additional staffing support. I'll have to take that back and get back to you. Forgive, I didn't come prepared with an estimate right now.
No, you're fine.
Gonna real quick turn over to Joshua. Any additional thoughts that
No, but if we have additional thoughts at this point, we can get back to you.
Thank you very much.
The question was triggered by when you said there was 2,000 site inspections. So just curious.
We do regular review of food and commercial retailers anyway, right? So it isn't necessarily that there's additional sites that we're covering, but I think I want to make sure that, the additional work that comes with identifying an additional range of products at sites does come with additional work. So I would want to make sure that as part of our report back, that was considered in our recommendation. Right now, Kratom and 7-OH are marketed. So there's a lot of marketing. There's folks that report a variety of purported uses for Kratom and 7-OH. Neither are FDA approved to treat any medical conditions. So just to be clear, although there's a lot of marketing that talks about these as medications, they're not FDA approved medications that are prescribable through pharmacies in the traditional way that we prescribe medications to treat medical conditions. But there are a whole number of claims about Kratom and 7-OH conditions. I just don't want to misstate. I don't want to misstate that has gone through the FDA review process. One of the things that we have put out there is we have heard from a number of community advocates talking about the use of Kratom and or 7-OH products to self-treat withdrawal, to treat pain syndromes. And we do have FDA approved medications for opioid use disorder that can treat opioid withdrawal that, depending on the which medication is chosen, can have analgesic properties. And so one of the things that we've made sure to put out to our treatment network is what treatment options are available for opioid use disorder, and make sure that the current guidance on the treatment of pain is available in the community.
We can't hear none of their questions.
Morning, everyone. My name is Abdullah. I'm actually the owner of Authentic Kratom, a company that I started 12 years ago. I'm based in Los Angeles. My company mainly focuses on natural Kratom. And Kratom has been used for centuries, it's not a new thing. I would like to oppose the idea to ban this Kratom and the 7-OH. I would like for you guys to take a look at overall picture where natural Kratom has helped millions of people all across the country. Recently on FDA, last year, July 29th, 2025, actually, FDA came out and they stated that Kratom, actually, their primary focus is not Kratom that has traceable amount of synthetic OH on it, so 7-OH on it. They are focusing on the synthetic version of the 7-OH, which is very, very dangerous. And as a Kratom vendor for 12 years, I heard about it a few years ago. There are a lot of people who were calling me, asking me to carry their product. It's very profitable, apparently. And I decided not to do it. I refuse to carry anything that's like harmful for people. And in my 12 years in business, I have spoken to thousands and thousands of customers. I've done phone calls with the customers. People literally cry on the phone how that Kratom plant has changed their lives. It's not the 708, it started 3 years ago. Ever since that whole 708 thing started, I have customer walks into my shop and they're asking me, hey guys, do you guys carry 708? They have no idea what 708. They're just taking it, they're finishing it, they're just coming back for more. It's a dangerous drug out there. And even the FDA commissioner said last year that Kratom is like 10, 15 to 30 times stronger than morphine.
I comment in the room first. Okay. Good morning, Chair Garcia Delgadillo and members of this committee. My name is Jackie Subek. I am the Executive Director for Seven Hope Alliance, a nonprofit dedicated to public education, advocacy, and science on 7-O and Kratom, two naturally occurring alkaloids in the Kratom plant. I'm speaking here today in support of child safety and responsible regulations, and in opposition of any criminalization of these products. Kratom and 7-O are not separate issues. They are the same plant, the same community, and are used by the same people, responsible adults, many of whom rely on these products to simply get through their day, including 75% of these consumers who use it specifically for chronic pain. The average Kratom consumer is a 43-year-old man trying to maintain a quality of life, go to work, and take care of his family. Even more troubling is that 17% of surveyed 7-O consumers said that if these products were banned, they would consider suicide. These substances are being used as harm reduction tools, often as alternatives to far more dangerous opioids that we already know are fueling the opioid overdose crisis. Last year, County Health declared that 6 deaths were linked to 7-O. But when the toxicology reports were reviewed, all 6 of them revealed polysubstance use, including benzodiazepines, cocaine, and one that was deemed acute alcohol intoxication. And nationally, there has not been one single death attributed to 7-O alone. If nearly 300,000 Angelenos are using these products every day to have a better quality of life, why is public health picking winners and losers without doing one single study session? Perhaps it makes sense to slow down, look at the science, and talk to consumers and work towards a regulatory package. There is no actual crisis. Alternatively, the county could just wait for the state. Last week in Sacramento, a bill was heard on 7-O. Every single committee member was crystal clear that Kratom and 7-O needed to be studied and that regulation, not prohibition, was the clear pathway.
Hi, I'm Justin Wolf, founder of a beverage brand called New Brew based here in Los Angeles, actually. I guess I want to use my time to just point to something that's very simple. There's already a solution to this underway in the legislature in California. It's the bill AB 88. It's the common sense regulatory framework, very similar to the framework that's gone into law in 19 other states now. Most recently, New York, the governor signed it into law just last month. There's a lot of work that went into this, right? This is not something that was just drawn up at the last second. Heavy debate has gone into this. Both sides have been considered, and the result is a very balanced sort of approach where we're ensuring that these kind of products are restricted to just 21 and up adults. There are lab testing requirements, labeling requirements. It helps clean up the industry. The bill also does include a cap on 7-OH content that can be included in the Kratom product. This is supported by Joe Biden's former national drug policy director, just about every police department up and down the state of California. Many medical and legal experts around the country as well. So that has already passed unanimously through California Assembly. It's just waiting to be seen by the Senate. So I really think it's great if LA County adopts a similar framework at the local level, sure. Ultimately, this has already been weighed in on. It's already being worked on. And, I think the actions of the health department are, they're well-intentioned, right? Because there is a public health emergency. But unfortunately, they've conflated these two different substances, and they are very different substances. I'm sorry, they just are. They're chemically different, literally pharmacologically different. They have different risk profiles, abuse profiles, and unfortunately, a lot of money and energy has gone into perpetuating this confusion. These need to be separate things, okay?
Yes, good morning. My name is Luis Gonzalez. I am a state board licensed barber residing in Los Angeles County for the past 8 years. I'm asking, why are these deaths appearing only recently when the products have been on the market for years? In 2023, I developed severe sciatic nerve pain due to the physical demands of my profession. For example, standing 8 to 10 hours a day, 7 days a week. During flare-ups, my pain reached a 10 out of 10 level pain on the pain scale, and often prevented me from doing minimum physical activity and going to work. I tried all physical therapy recommended methods to help with this issue. Yoga, acupuncture, what do you call it? The massage, yeah, physical therapy. And no relief, no relief. Maybe only a minimum temporary relief from those methods. Then I discovered 7-OH, and well, first I discovered Kratom, and then the Kratom was good. I'd say pretty large doses for me to see any real benefits. Plus it was like getting me like it was hard to go to the restroom when taking large amounts of Kratom. I started using 7-OH with Kratom here and there, and allowed me to manage my pain and remain employed. From a county perspective,
Hi, I'm going to read my statement here. About 25 years ago, I suffered a tragic accident that left me debilitating pain. I was giving opioids. My doctors led me to become dependent. Throughout the next few years, I had 3 massive back surgeries and dozens of other treatments to address my injuries. But the main treatment was opioids, a lot of them. I became both an addict and a chronic pain patient, taking up to 60 pills a day to get by. I developed tolerance, and then they would increase my dosage and type of narcotic. I was a walking zombie on long-term disability. My constant desire to get clean off these meds led me to be in and out of rehab facilities, maybe many hospital stays where I would be chemically detoxed by doctors and nurses. The times I would be free of my addiction, I would be confronted with the chronic pain of my injuries. I was a prisoner to opioids, unable to work, exercise, or have healthy relationships with friends and family. Until I discovered Kratom. Kratom saved my life. It allowed me to be able to cope with my chronic pain, as well as allow to have a normal quality of life off of opioids. I now work full-time, work out 6 times a week, and feel liberated from years of constant withdrawals and addiction. It allowed me to again be able to have good relationships with friends and family. With 8 little grams of a green natural powder a day, I feel great, all while never needing to increase my dose. It keeps me pain-free and helps my depression and anxiety, all while never needing to take the poison that stole many years of my life. So I ask you to please keep natural Kratom leaf legal and accessible. I am in favor of banning 7-OH, which is not Kratom leaf. It is a concentrated form, 100 times the strength, and very dangerous. I ask you consider regulating Kratom like more than a dozen other states with the Kratom Consumer Act, which would ensure Kratom products are not adulterated, limit sales to individuals at least 18 or 21 years old, and require proper labeling. Kratom has saved so many lives, and it gives people a natural way to cope with their chronic pain and depression. If you took this plant away from me, my whole world would collapse.
continue.
Comment.
Okay.
For people who are online on the call, if you'd like to speak in public comment, please raise your hand in the app and your name will be called in order. Everybody else online, please keep your line Muted. Thank you. Do you want me to call? David Wolf, you have 2 minutes.
Hi, how are you? I'm not David. David's my husband, but we're on his phone. My name is Melody Wolf, and I was the one that spoke at the HHS and FDA press conference. They asked me to speak, and they welcomed me to their platform. The FDA commissioner did ask me to talk about the benefits of Kratom, and then to distinguish it from 7-OH, which definitely needs to be off the shelves. I'm a 12-year daily consumer. I used to be bedridden. I was bedridden for about 8 years. And I found Kratom, thank goodness. And ever since then, I've been pretty active. My pain used to be at an 8 to a 10 daily, and now it's a 2 to a 4. And the commissioner and HHS secretary, they were very clear that they are not going after the plain leaf products. They want to get the 7-OH off the shelves, and so do I. Thank you so much.
On Schinholzer.
Yeah, I'm John Schenholzer, the Advocacy Director for American Veterans for Kratom Safe. I'm also been in the addiction recovery space for over 43 years. I've been sober myself over 43 years. Over the last 15 years, I've seen thousands and upon thousands of addicts and alcoholics and prescription addicts pivot from these dangerous substances to, they pivot from a one pill kill to a Kratom product that was properly packaged, third-party tested. Everything you're consuming is right on the label. They use FDA regulatory guidelines for packaging, and the miracle of this plant is incredible. I've never seen a natural leaf Kratom addict that I've met 3 out of 1,000 taking natural leaf that the 3 of them they stopped taking it after a while. They went to treatment. Now, Kratom, a lot of people come into my life, they pivot from these one pill kills, they get into Kratom, we have relationships, and it's a segue into clinical services should they need, a higher level of services and medication assisted therapies. The Congress made it a rule in 1994 to protect consumers so we could have choice for products out there. Please don't have a knee-jerk reaction to the demonization of the natural Kratom leaf plant. So many people are going to be hurt by this. I expect thousands of people will actually die if we ban Kratom. It doesn't make sense. And of all the addictions you can have, natural leaf Kratom, that's the best one to deal with, probably the easiest one to get people away from it or off of it. So, I want to support just common sense Kratom regulation, natural Kratom plants. Sounds like you got a problem with synthetics and these other products. Kratom's not the problem. Kratom's a solution.
Dan Gibbs.
Yes, can you hear me? Can you hear me?
Yes.
You can hear me?
Yeah.
Okay. So good afternoon. I'm speaking in support of the SD4 preventing deaths related to Kratom and 7-OH. I respectfully urge that the recommendations from this motion include a total ban on Kratom and all Kratom-derived products, including the so-called pure leaf. I'm here because my son Austin died at 25 years old after using a Kratom product he believed was safe because it was marked as natural leaf. His official autopsy determined that my trigenine toxicity was the cause of death. There were no illicit drugs, no prescription opioids involved. That loss is permanent, and that is why I'm here. You will hear advocates argue that pure leaf Kratom is safe and that only synthetic or enhanced 7-OH products should be restricted. But those same advocates often say Kratom eliminated their need for morphine, oxy, or even heroin, and that it saved their lives by treating severe chronic pain. They don't realize it, but that argument undermines their own position. A substance powerful enough to replace opioids is, by definition, opioid active and pharmacologically potent. You cannot credibly argue that it is both life-saving opioid substitute and a harmless supplement. When federal regulators such as the DEA and the FDA evaluate whether a substance should be restricted, they consistently look at three things: how it works in the body, its potential for abuse and dependence, and its impact on public health, including death. By those same criteria, Kratom meets the threshold, even in leaf form. Importantly, this conclusion is not isolated. In January, the Ohio Board of Pharmacy determined that naturally occurring mitragynine in Kratom presents an unacceptable risk to public health and moved to prohibit Kratom products statewide, explicitly rejecting the idea that pure leaf can be carved out. SD4 also notes that Los Angeles County Public Health warned retailers to stop selling these products and initiate enforcement, and that the safest public health guideline is to avoid Kratom and Kratom-related products altogether. I respectively ask that SD4 report back include a countywide ordinance banning Kratom.
Chamberlain?
Hi, can you hear me?
Yes, we can.
Okay, hi. My name is Wendy Chamberlain, and I'm here today as a mother who lost her only child because the truth about Kratom was never made clear. My son Joseph was a business owner and the father of three amazing boys. He was smart and funny and lived every day for his family. He was my best friend in my life. Like so many other parents, I believed Kratom was safe, natural supplement, and was sold openly with no meaningful warnings in places like gas stations and vape shops. Joseph died from mitragynine toxicity only. No other substances, the primary alkaloid in Kratom. The product involved was plain leaf powder, marketed as a so-called GMP product. Seeing something I believed was harmless listed as the cause of my child's death is something no parent should ever have to endure. This is not an isolated tragedy. In 2024, 2% of unintentional overdose deaths tested positive for mitragynine, the active drug in Kratom. That percentage represents approximately 3,930 lives lost. Behind every number is a family forever changed. Kratom acts as the same receptors as opioids. It can cause dependence, suppress breathing, and in some cases it can kill, especially when people are never told the real risk. Communities across the country have tried measures, age limits, warning labels, and so-called consumer protection laws. They have failed. States like Utah learned that regulations does not stop harm when products is unpredictable, unregulated, and aggressively marketed as safe. 6 months after my son died, I founded Kratom Danger Awareness. What began a small support group is now grown into a national nonprofit providing education, outreach, and support to families affected by Kratom harm. Through Joseph's death, I have connected with thousands of people who share this loss. We are not funded by, nor do we work for, trial attorneys. We are parents, families, and advocates trying to prevent another call like the one I received. Today, you have the power to protect your community before another life is lost. Thank you for listening, and thank you for choosing life and safety.
Thank you, Wendy. Tony Rodini? Unmute yourself.
Hey, hi, can you hear me?
Yes, thank you.
Okay, sorry, I'm not much of a public speaker, but I'm gonna just do my best to uh to read testimonial that I've written. I am a resident in LA County. I've been using Kratom for almost 10 years, and I'm a strong advocate for the plant. I have severe obsessive compulsive disorder as well as anxiety and a tic disorder. Kratom significantly helps reduce my anxiety, which in turn helps me manage the tics, ruminations, and other difficult symptoms caused by my conditions. Science will support that the natural plant in its unadulterated state poses no threat to the public health and safety. I believe that the 7O products are the problem and should be recognized as so. Um, I guess I'll just point out, I just want to echo a few things that I've written down that I've noticed within this call that other people have mentioned. And, why have deaths only been noted as of a few years ago? Because, Kratom's been on the shelves for over a decade. So there's obviously some underlying new problem. I think regulation is okay, or is good, not prohibition. And I guess lastly, I would like to say that I think thousands and thousands of people find benefit from the natural plant and help them experience um, a healthy living, well, a healthy, life.
Thank you. Matthew Lowe?
Yeah, I'm here. Can you hear me? Good afternoon, Chair and members of the cluster. My name is Matthew Lowe, and I'm the Executive Director of the Global Kratom Coalition. We share your goal of wanting to prevent deaths and harm that come from from access to dangerous synthetic products like concentrated 7-OH. However, we implore you to make a key distinction between natural kratom leaf, a centuries-old botanical, and these novel opioids that masquerade as dietary supplements and masquerade as natural. I want to distinguish between the two very quickly. Natural kratom leaf is a botanical from Southeast Asia with centuries of safe traditional use. It's been consumed in the US for more than 50 years and is currently safely consumed by 23 million Americans. NIDA has funded over $100 million in natural kratom research over the past decade, funding research at leading universities. Natural kratom leaf has 18 human clinical trials that have been done to date, all showing its safety. Natural kratom leaf is a complex botanical made up of 50 different alkaloids, which make up 2% of the weight of the leaf material. It contains 50% fiber and 25% antioxidants. Natural kratom leaf only contains only trace amounts of 7-OH. However, by contrast, these novel synthetic 7-OH products are novel lab-created opioids that have synthetically enhanced levels of isolated 7-OH that concentrate the potency to more than 100 times that of which is found in natural kratom leaf. The result is a concentrated synthetic product that is 13 times more potent than morphine. These products have no history of safe use, no clinical or preclinical work to show their safety, and are devoid of the 50 natural alkaloids, the fiber, and the antioxidants that make up natural kratom leaf. Federal leaders drew this line last year when the HHS, FDA, and DEA announced a coordinated federal effort to schedule concentrated synthetic 7-OH. Crucially, the FDA made it clear that their recommendation only applies to products containing concentrated unnatural levels of 7-OH, and they are not focused on natural kratom leaf. We implore you to follow the lead of the state with AB 1088, draw this distinction, regulate natural kratom leaf, ensure it's only accessible to adults, and prohibit concentrated synthetic 7-OH. Thank you for your time.
Jessica L.
Hi, are you able to hear me okay?
Yes.
Okay, great. So my name is Jessica Lawless, and I appreciate this opportunity to speak today. And my heart goes out to everyone who has lost a loved one to drug overdoses, alcoholism, or suicide. My life has also been full of these traumatic deaths. What I want to talk about today is the fact that I'm a Californian and a 7-O consumer. I use both 7-O and Kratom for chronic pain associated with Crohn's disease. I strongly oppose the banning or criminalization of 7-O or Kratom. This botanical is a critical part of my healthcare regimen. It supports my prescription medications and makes it possible for me to fully participate in work and family responsibilities. Before I was using 7-O, I only had partial physical mobility due to nerve pain caused by stress and inflammation. Today, not only am I able to walk without a cane, I'm also able to exercise, socialize with friends, and travel, all things that give me an improved quality of life. When you look further into the kratom plant and the health benefits from the alkaloids in this plant, you'll learn, as I have, that this is an important product California consumers should have available as a choice in individual wellness plans. I urge you to recommend reasonable regulation, not prohibition or criminalization. We have a long history that shows prohibition doesn't work, and it will result in many of us seeking harder drugs or even choosing suicide if we don't have this tool for harm reduction and pain relief. Thank you very much for your time.
Brody Baker.
Good afternoon. My name is Brody Baker, and I'm a resident of Los Angeles County. I am submitting this testimony to clarify the important distinction between natural kratom leaf products and highly concentrated or synthetic compounds such as 7-OH. Natural kratom, when responsibly produced and used by adults, is not the same as 7-OH isolates or chemically enhanced products. Conflating these substances leads to misleading conclusions and unnecessary harm to consumers who rely on natural kratom as a safer, regulated alternative. I would also like to be clear that I've never had a dependency on alcohol. However, even without dependency, alcohol consumption still carried physical, mental, and emotional consequences for me, harms that are widely recognized and well documented. In California alone, on average, annually, 19,000 deaths per year are attributed to excessive alcohol use, including chronic acute causes such as liver disease and injuries. Seeking a healthier adult alternative for social settings, I discovered natural kratom beverages. After transitioning away from alcohol and choosing natural kratom instead, I experienced a dramatic improvement in my overall well-being. My physical health improved, my mental clarity increased, and my emotional stability strengthened. I was able to remain socially engaged without the negative consequences I previously experienced from alcohol. The shift had a positive effect beyond just me. My wife, friends, and family have likewise benefited from having a social beverage option that does not involve alcohol. Social gatherings became more inclusive, supportive, and health conscious without the pressures or harms commonly associated with drinking. The decision was not about intoxication or substitution for dependency. It was about harm reduction and making a responsible, informed adult choice. I support reasonable regulation of natural kratom products, including age restrictions, quality control standards, labeling requirements, and bans on synthetic or dangerously concentrated derivatives such as 7-OH. These measures protect consumers while preserving access for adults who benefit from natural kratom as a safer alternative to alcohol and other high-risk substances. Natural kratom should be regulated responsibly, not prohibited or misclassified, so adults can. Thank you for your time.
Misty Brown.
Hi. My name is Misty Brown, and I am a Colorado kratom advocate and activist. I want to say that there is a critical scientific difference between whole leaf kratom and the products being sold today as 7-OH. Whole leaf kratom is simply the dried leaf of Mitragana speciosa. Its primary alkaloid is mitragynine. When someone consumes kratom, the human body naturally converts only a small amount, typically well under 1%, into 7-OH through normal liver metabolism. This process is slow and self-limiting. By contrast, the 7-OH products now appearing on the market contain laboratory, isolated, or chemically converted 7-hydroxymitragynine in amounts far beyond what the human body could ever produce from kratom leaf. At those levels, 7-OH behaves much more like a conventional opioid and carries a much higher risk. When these high-potency 7-OH products are lumped with natural kratom, it leads to a misleading risk assessments and poor public policy. Regulating or restricting 7-OH does not require banning whole leaf kratom, and that distinction matters because kratom saved my life. From 2008 to 2019, I lived trapped in FDA-approved pain pills, benzos, and muscle relaxers prescribed for my degenerative disc disease. Over 11 years, chronic pain management turned into a full-blown addiction. What began as a dependency slowly became a cycle of misuse, desperation, and shame. In April of 2019, I was dismissed from pain management after failing a required pill count. I was short on my medication and couldn't find what I needed. Cut off from prescriptions, I turned to the streets. And in that desperation, I slipped into cocaine use while trying to find another doctor. By June of 2019, I was in withdrawal and at rock bottom when I watched a documentary called A Leaf of Faith. That moment changed everything. The next day, I walked into a smoke shop, showed my ID, bought whole leaf kratom, not synthetic 7-OH. Kratom quieted the relentless cravings, the voice that kept saying one more pill, one more snort, and one more escape. Is it over?
Yes, thank you.
Okay.
We still have a number of speakers who have their hands raised, and due to the limitations of time for this meeting, we're going to need to reduce our public comment to 1 minute each. Thank you for your understanding. Susan, go ahead. Epard?
Hello, my name is,
I'm sorry, you have two
yes,
Susans. Go ahead, Susan.
Susan Epard.
my name is, yes, hello. My name is Susan Eppard, and I support banning all forms of kratom. In 2021, my 22-year-old son, Matthew Eller, died from whole leaf kratom powder, the least potent form of kratom available in the United States. Kratom caused him to have a seizure, go into cardiac arrest, and die a violent death on his kitchen floor in front of his girlfriend. His toxicology showed he died from the toxic effects of metragenine, an alkaloid found only in kratom. He had no prescription drugs, no street drugs, nor alcohol in his system when he died. And his autopsy showed he had no underlying health conditions. And it's very important to note that my son did not die from 7-OH or 7-hydroxymetragenine. Kratom is not routinely tested for post-mortem, as many users hide their usage, and even when families know about it, they don't likely think to ask for toxicologies because it's advertised as a safe herbal supplement. You likely receive many calls, but keep in mind.
Dr. Michelle Ross.
Hi there. Thank you, everyone. I'm an addiction expert and court qualified kratom expert, and I did a research study on 7-OH of 1,521 users. 8% are veterans, 2% are current or retired law enforcement, 12% of users are healthcare professionals. So I want to be clear here that there's a lot of misinformation and misunderstanding about who 7-OH consumers are, who kratom users are, and the safety. In this presentation, it's been stated that not a lot of metragenine and kratom is converted to 7-OH. 24% of the metragenine is. There's over 2.4 million kratom users in California, and every single one of them has a high level of 7-OH in their body right now. So there is not a crisis from 7-OH products. We need regulations for the entire product category. And I would like to be available as an expert to help guide some of the misinformation that's been presented here and elsewhere, especially by the FDA.
Thank you. Jordan.
Okay, my name is Jordan Richard. I'm the author of The Truth About Kratom, Life-Saving Plant and Botanical Menace. I spent years traveling across the United States and Southeast Asia, interviewing leading experts, toxicologists, policymakers, farmers, and people who have used kratom and have been directly affected by kratom. I'm writing you to urge not to ban kratom in Los Angeles. You're comparing two very different substances. Kratom is a natural leaf that has been used continuously in Southeast Asia for more than 1,000 years. There's never been a single death attributed to kratom. Millions of people for all that time, not one single death. In 2024, the U.S. Food and Drug Administration released their first human study on kratom, include that kratom appears to be safe. It's critical to be clear, the FDA approval and FDA stating substances are safe are obviously two different things. Plants don't, you can't have plants that are FDA approved. What matters is that the FDA's own research did not support the claim that natural kratom leaf is inherently dangerous. The FDA commissioner has publicly stated that the agency is not targeting the natural leaf, but rather isolates and semi-synthetic
Thank you.
products. Yeah, thank you.
Thank you. Jennifer Gillis.
Yes, hi, my name is Jennifer Gillis, and 20 years ago, I was diagnosed with transverse myelitis and became a lifelong chronic pain patient. After losing access to prescription medications that I had relied upon for so long through no fault of my own, I spent years struggling to manage my pain. One day in 2019, I discovered holy kratom powder. It truly gave me my life back. Kratom has been a lifeline for so many people just like me who want to live a functional, meaningful life and not have to deal with chronic pain. I'm asking that you support regulations like lab testing, age restrictions, and also limiting the amount of 7-OH in the kratom products that are available to the public. Thank you.
Thank you. Amanda Rayner.
Hi, my name is Amanda. I live with 10 out of 20 of the most painful conditions to live with, trigeminal neuralgia being one of them. I was thrown on pain medication at the early age of 9. I was also on depression medication, blood pressure medication, and anxiety medication. In the last almost 8 years, or almost 8.5 years, I have not had to consume well over 50,000 pharmaceutical pills. I also lost my mom to the hands of the pain clinic. My doctor told me there's no way that I can treat you properly. We cannot properly treat you. So I suggest you look for alternatives, which I did, and I found Kratom. I also utilize 7-OH when I have Crohn's disease flares. I am not an addict. I am disabled, and I am able to function every single day with Kratom and my 7-OH. If you take this away from me, my life will not exist anymore because I cannot live or be treated by the doctors ever again. Thank you so much.
Thank you. Venus Usher.
Good afternoon. My name is Venus Usher, and I'm asking you to keep plain leaf kratom legal, regulated, and not banned. In 2000, an FDA-approved medication caused severe kidney stones and constant pain and many illnesses. For 17 years, doctors didn't believe me. I was labeled a drug addict, sent to rehab, and put through unnecessary surgeries, including a botched hysterectomy. And then 9 years ago, I found plain leaf kratom tea. It's simply a crushed leaf made into a tea. The relief was immediate and stronger. Sorry, kittens. And stronger and helped me better than anything I'd ever tried in nearly 2 decades. It allowed me to finally undergo a 3-hour surgery that proved my pain was real. And afterwards, I refused prescription drugs, had them removed my IV, and finished drinking my kratom tea in the hospital. I healed. Plain leaf kratom does not cause respiratory depression, has a natural safety limit. People use it responsibly to live normal lives. Bans don't protect people, they criminalize them. People like Marshall Brown, who got 10 years and was murdered in prison, and Shayna Brown, who's facing 10 years in jail.
Venus.
Please.
Ryan Sherman.
Hi, my name's Ryan Sherman. I'm with the California Narcotic Officers Association, and we are in complete support of any and all restrictions the county is willing to take on 7-hydroxy concentrated synthetic products. We've been working throughout the state with counties and cities to ban this substance. We believe it's very dangerous and lethal, and don't want to take my word for it. On the back of these products, many of them contain the following warning: do not use the product in combination with any psychoactive, intoxicating, impairing substance, including other botanicals, alcohol, nicotine, cannabinoids, or illicit substances. Don't use if you have health conditions or use prescription medicine, over-the-counter drugs, or dietary supplements, except under supervision of a physician. Don't use before engaging dangerous activities, operating machinery, or operating a vehicle. Products not intended to be used with alcohol, nicotine, cannabinoids, prescriptions, etc. Thank you.
Susan Cave.
Yes, ma'am. Can you hear me okay?
Yes, we can.
Yes, my name's Susan Cave. I'm the mother of William Cave, who passed in 2024 to Kratom. I want you to know that my testimony is not just about my son, although I am a grieving mother. States that have chosen regulation are now seeing the consequences: continued deaths, escalating product potency, and a false sense of security. Might I ask you, do you really think regulations are enforceable? Do you think regulations can keep up with the ever-evolving $1.5 billion kratom industry? Do you think bad actors won't enter the market and exploit this product? Do you question your knowledge about kratom and what it's doing to families around the country? Do you think it would be the right thing to do to ban 7-OH and only regulate kratom that contains 7-OH? Does it go against your good common sense to look at 7-OH as a completely separate animal from kratom when raw kratom contains 7-OH? Do you think people can be responsible kratom consumers when so little is known about how to consume kratom safely? No lethal dose has been established.
Laredo.
Good afternoon. My name is Jeff.
Thank
You
you.
hear
Go
me
ahead.
all right? My name is Jeff Laredo. I spent 30 years as a federal drug use and addiction science policy official. I'm now a California resident and a consultant to the American Kratom Association. I'm here today to urge you to rely on science and evidence as you consider this motion and any follow-up actions that you choose to take. Don't be distracted by all of the hyperbole that you hear. I want to fully agree with and associate myself with Matthew Lowe's remarks and others about Kratom versus 7-OH. The AKA fully supports regulation, and LA County has a really well-earned reputation for sophistication and reliance on science and scientific evidence when it comes to public health. So in this case, let's add even more evidence for that reputation. Thanks very much.
Thank you. Caller with the phone number ending 9696. 760-412-9696. Press *6 to okay, Gold Leaf Botanicals.
Hello. Hi. My name is Rob Nichols. I own Gold Leaf Botanicals. Can you all hear me?
Yes. Good. We can hear you.
Can you hear me?
Yes, we can. Go ahead.
Okay, perfect. Sorry. I'm sorry. I had the voice thing.
So I've been taking Kratom and working with people that have been successfully using Kratom to manage chronic pain conditions, suicidal ideation, opiate addiction, you name it. Kratom is an effective alternative to harmful synthetic drugs and it saves countless lives annually. The isolated incidents of adverse reactions to supposedly plain leaf Kratom, where like my heart goes out to the people that have lost family. The Kratom as a leaf does not kill. Like there may be a few isolated incidents, but it saves millions annually.
Thank you.
So,
You can go ahead and unmute yourself and speak.
Hello there. My name is Matthew Shamira. I'm a resident in Irvine, California. I'm just here to say my piece as just like an average guy. There are definitely companies out there that are really dedicated towards making products that contain Kratom responsibly. And I'm a consumer of one of those. One of those products is New Brew. It's very mild effects. It's been nothing but a benefit to me just in my everyday life. It just helps calm, it gives you a calm sensation. There's nothing addictive about it. So I know that the founder is really prominent, is a big advocate on doing and creating these products responsibly. And I definitely think that there's a right way to go about this and a wrong way. And an outright blanket ban would certainly be one of the wrong ways. So thank you so much for your time.
Thank you. All right, we'll try this one more time with Gold Leaf Botanicals since the person calling in had started speaking. So Gold Leaf Botanicals, go ahead. You can unmute yourself. Gold Leaf Botanicals. While we see if that, oh, there you go. You're unmuted.
I'm sorry. Can you hear me?
You can. Go ahead.
Okay. Thank you. My name is Rob Nichols. After discovering Kratom, I started a business, which is what's displayed to you. I don't know how to fix that yet. Anyway, when back in 2015, I was in a hospital and I was addicted to the opiate, the drug. I don't even remember the name, but I got addicted to it in one day. In one day, I became addicted to this drug and I was introduced to Kratom, and Kratom helped get me off of that. Kratom leaf powder does not slow the breathing. The addiction, I'm 32 years clean and sober. Every day in my business, I help people, chronic pain people, and numerous variety of them that have no other solution. And they find out about Kratom and their life is changed. In addiction, there's not just the physical addiction, there's also a mental addiction, which nobody has spoke about, which also needs to be addressed. As I said, I'm 32 years clean and sober. There is a God, and I'm not it. And I'm done, ma'am. Thank you very much. Kratom needs to be kept safe and legal.
Right, so before we close public comment, I'm just going to ask if anybody who is calling in would like to speak and wasn't able to raise their hand. If you want to unmute yourself using *6, you can do so. We'll call you by your phone number. Anybody calling in want to speak?
Yes, can you hear me?
Yes. Phone number
Hello, hello.
2977. Yes, go ahead.
Yeah, 2977.
I'm going to call 2977 first.
Can you hear me?
Yes, go ahead.
I just want to my name's Adam Blum. I'm a consumer and a retailer. And I just want to put this in really simple terms. I like when I talk about this, I like to compare it to coffee. Coffee's been around for forever. Millions of people use it every day. It's familiar, relatively low risk. And then imagine someone comes around, they isolate the caffeine, they super concentrate it, they put it into a tiny pill, and they start selling it aggressively, and then people start dying and getting hurt. That's what's happening here. And you wouldn't ban coffee. You'd come up with a way to get rid of this crazy high potency extract that has just come on the market a few years ago when coffee's been around for thousands of years. And that's what's happening. Kratom leaf is the coffee, and the 7-OH products are the super potent synthetic caffeine pills that somebody's come out, and now everyone's getting hurt. It's very clear to me what to do. You regulate Kratom, you get rid of 7-OH. You know, right now a 4-year-old can walk into a store and buy Kratom. That's ridiculous. Everyone's known that. Even all these brands have known it. You should regulate Kratom. It should be 21 and over, and the product should not have. Yep.
I've already called on 9696, so I'm not going to call on that again. Phone number ending in 2493.
Hi, that's me. My name is, can you hear me?
Yes.
My name is Dion Evans, and I'm a Kratom consumer and have been for the last 9 years. I am terminal. When the epidemic hit with the opioids, everyone was dropped from pain relief and pain meds. I was a half an hour away from taking my own life after a year of trying to make it and trying to find some way of getting through my life. And that's when I found Kratom. Kratom, everyone compares it to opioids. It's nothing like an opioid, but yet it relieves enough pain for people to get by. It's changed my life, and it's given me 9 years with my family that I would not have had if it weren't for Kratom. And it just gave me my first great grandchild.
Thank you, Dion. Phone number ending in 1655. I'm sorry, 1665.
Hi, that's me. Can you hear me?
And go ahead.
Hi. So my name is Evan. I live in Irvine, but I used to live in Los Angeles, and I work in Los Angeles. So I've been a consumer of Kratom as well as 7-OH, but less frequently. But the reason, I guess, why I'm calling today, there are a lot of issues in LA County right now: homelessness, fentanyl overdoses. I mean, this is really below the radar, and I'm kind of surprised to respectfully say that, this is being even discussed as a public health emergency. I don't know of any deaths that have occurred solely due to 7-0. I'm sorry. Can you hear me still?
Concludes public comment on this item. Yes. All right, thank you.
Good afternoon, everyone. My name is Allison Burton. I want to be very clear. Banning or criminalizing Kratom and 7-0 would cause real harm. I suffer from severe debilitating migraines. When one hits, functioning is impossible. The slightest light feels like I'm being stabbed in the head. The faintest smell makes me violently nauseous. Sound and movement amplify the pain, and even opening my eyes can be unbearable. It's not just a headache, it's a total physical shutdown. I am highly allergic to sumatriptan, one of the primary migraine rescue medications. Other standard treatments have failed me. Kratom is the only thing that likely helps during an active migraine and allows me to function. If you criminalize it, you are not protecting public health. You are taking away the only effective option some of us have when medicine fails. Do not legislate me into suffering when safer regulation is available.
Item. Thank you all so much for taking it. Deputies, we received 31 letters prior to the meeting, more by now. So I will be sure that those are part of the meeting record and they will goes to the whole board. And the address for public comment in chat